Welcome to today's video about early signs of breast cancer. Did you know that breast cancer is the most common cancer among women worldwide? Every year, over 2.3 million women are diagnosed with this disease. But here's the thing. When caught early, breast cancer is highly treatable, with survival rates skyrocketing to over 90%. Now, here's a question for you. What if you could recognize the warning signs before it's too late? Would you know what to look for? Lumps and bumps might come to mind, but did you know that redness, fatigue, or even a slight change in breast size could be your body's way of saying something's wrong? Stick with me because in this video, we're diving deep into the 10 early signs of breast cancer, backed by the latest research. And trust me, some of these signs will surprise you. By the end, you'll not only be more informed, but also empowered to take control of your health or help someone you care about. Ready to learn the signs that could save lives? Let's get started. Please note, this content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a healthcare provider regarding any medical conditions or concerns. We'll break down the early warning signs of breast cancer, beginning with the most common: lump in the breast or underarm. A lump in the breast or underarm can often be one of the earliest signs of breast cancer. This happens because cancerous cells multiply uncontrollably, forming a mass that can be felt. While many lumps are benign, such as cysts or fibroadenomas, some may indicate malignancy. Cancerous lumps are often hard, irregularly shaped, and immovable, though some can be soft and tender. It's crucial to note that not all lumps cause pain, which is why regular checks are essential. A recent study published in South African Family Practice, 2022, highlighted that over 60% of breast cancer diagnoses involve a palpable lump as the initial symptom. The study also emphasized the importance of size. Lumps smaller than 2 centimeters at detection often have a better prognosis due to early-stage identification. Lymph nodes in the underarm may also swell because they are part of the immune system. If cancer spreads, these nodes often catch malignant cells, leading to noticeable enlargement. For example, women have reported finding swollen underarm nodes months before a breast cancer diagnosis. Regular self-exams, mammograms, and prompt medical consultation when noticing a lump can significantly improve outcomes. Early detection saves lives. Next, number 2, change in the size or shape of the breast. Changes in the size or shape of the breast can be an important early warning sign of breast cancer. This happens because tumors or abnormal cell growth within the breast tissue can alter its structure. When cancerous cells grow, they may form a mass or lump that causes one breast to appear larger, uneven, or misshapen compared to the other. Sometimes the skin over the area may also tighten, making the changes even more noticeable. Research published in the Medicina, 2021, highlights that these changes are often due to tumors disrupting the lymphatic system. When lymphatic vessels are blocked, fluid can accumulate, leading to swelling. This swelling might cause asymmetry in the breasts, even if no lump is easily felt. The study also noted that patients with size changes were 22% more likely to have early-stage breast cancer detected compared to those without such symptoms. Pay close attention to any persistent alterations in how your breasts look. If one breast suddenly becomes fuller or seems to droop differently, it's worth discussing with a doctor. Early detection can save lives, and being aware of subtle changes makes a big difference. Next, number 3, skin changes. Changes in the skin can sometimes point to breast cancer, and understanding what to look for is crucial. One of the most recognizable signs is dimpling or puckering of the skin, often compared to the texture of an orange peel. This happens when cancer blocks the lymphatic vessels in the breast, causing fluid buildup and skin changes. Redness or rash on the breast can also be a warning sign. Inflammatory breast cancer, or IBC, a rare but aggressive type, often presents with these symptoms. The affected area may feel warm, swollen, or itchy. A study published in a cancer journal for clinicians in 2022 highlights that 1 to 5% of breast cancer cases in the U.S. are IBC, and its symptoms are commonly mistaken for infections or benign conditions. The study stresses that delayed diagnosis due to these misinterpretations can impact survival rates. Thickened skin, especially if it feels different from the surrounding tissue, may also indicate cancer. Research shows that early intervention, when these changes appear, significantly improves outcomes. If you notice any persistent skin changes that don't resolve, it's worth seeing a doctor. Acting early can make all the difference. Next, number 4. Persistent pain in the breast or nipple. Breast or nipple pain is not always linked to cancer, but when it's persistent and localized, it can raise concern. Research shows that cancerous tumors can cause pain by pressing against surrounding tissues, disrupting normal function. While early breast cancer often develops silently, pain may sometimes be an initial symptom, especially in less common types like inflammatory breast cancer. A 2020 study published in the American Cancer Society highlighted that women with early breast cancer reported unexplained pain in the breast or nipple as their first noticeable symptom. This pain is usually not related to hormonal cycles and may feel sharp, burning, or like a consistent ache in a specific area. It's important to know that such pain could also result from benign conditions like cysts or infections. However, if the discomfort doesn't go away or is accompanied by other symptoms like a lump or nipple changes, it warrants further examination. Early diagnosis can significantly improve outcomes, and being aware of unusual, persistent pain is a step toward timely action. Always consult a healthcare provider if something feels off. Next, number 5. Unexplained nipple discharge. Nipple discharge can sometimes signal a serious issue like breast cancer, especially if it's unexpected and not linked to breastfeeding or hormonal changes. If the discharge is clear, bloody, or occurs without squeezing, it's worth investigating. This type of discharge may result from tumors in the milk ducts, such as ductal carcinoma in situ or invasive breast cancer. These conditions interfere with the ducts, causing fluid to leak. A study published in American Journal of Röntgenology, 2020, emphasized that 10 to 15% of cases with pathological nipple discharge are associated with malignancy. Researchers found that bloody discharge significantly raises the likelihood of cancer compared to other types. Imaging techniques like mammograms and ultrasounds often reveal abnormalities in these cases, further underlining the need for evaluation. Age can also be a factor. Women over 40 with unexplained nipple discharge are at higher risk of cancer, according to findings in the same study. However, even younger individuals should not ignore this symptom. It's also key to monitor for associated signs, such as lumps or skin changes. If you notice this symptom, it doesn't mean cancer is definite, but a doctor's visit is crucial. Early evaluation through clinical exams and imaging can make a significant difference in outcomes. Next, number 6, redness or warmth of the breast. Redness or warmth in the breast can be an early warning sign of a rare but aggressive type of breast cancer known as inflammatory breast cancer or IBC. Unlike more common forms, IBC often does not present as a lump. Instead, it causes changes to the skin and tissues of the breast, making it appear red, swollen, and feel warmer to the touch. This happens because cancer cells block lymphatic vessels in the skin, leading to inflammation and fluid buildup. The skin may also look dimpled like an orange peel. Research highlights that nearly 1 to 5% of breast cancers in the U.S. are inflammatory, but due to its rapid progression, early detection is critical. A 2021 study published in Cancer Medicine found that redness and warmth were among the most reported initial symptoms in women diagnosed with IBC. These symptoms were present even before the cancer had advanced to later stages, emphasizing the importance of paying attention to such changes. If these symptoms persist for more than a few days or worsen, it's essential to seek medical attention. While these signs can occasionally be linked to infections or benign conditions, ignoring them could delay a potentially life-saving diagnosis. Next, number 7, itchy skin on the breast. Itchy skin on the breast, especially when persistent and localized, can sometimes be a warning sign of breast cancer. This symptom is often associated with inflammatory breast cancer or IBC, a rare but aggressive form of the disease. In IBC, cancer cells block the lymphatic vessels in the skin, leading to inflammation. This inflammation can cause itching, redness, and swelling, often mistaken for an infection or rash. Research highlights that itching in these cases isn't the same as ordinary skin irritation. An article published in National Breast Cancer Foundation, 2024, emphasized that women with persistent, unexplained itching on one breast should seek medical attention as early detection of IBC significantly improves outcomes. The study found that approximately 5% of IBC patients initially presented with symptoms like severe itchiness, which they had overlooked for months. The itch may also accompany other symptoms like skin thickening, redness, or changes in the breast's appearance. Unlike allergic reactions or dry skin, the itching from breast cancer doesn't resolve with creams or antihistamines. If you notice such changes, don't ignore them. Speak to your doctor to rule out any serious conditions. Early action can make all the difference in identifying and treating potential breast cancer effectively. Next, number 8, breast tenderness or sensitivity. Breast tenderness or sensitivity can sometimes indicate an underlying issue, including breast cancer. While tenderness is commonly associated with hormonal changes or benign conditions, it's important to recognize when it feels unusual or localized. This is because certain types of breast cancer, like inflammatory breast cancer, can cause swelling and discomfort that may initially resemble tenderness. Unlike normal cyclical pain, cancer-related tenderness is often persistent and may feel concentrated in one area. A recent study published in the Cancer Causes and Control, 2016, highlights that about 5% of breast cancer patients reported pain or tenderness as an initial symptom. This is often due to the tumor pressing on surrounding breast tissues or nerve endings. The research also points out that inflammatory breast cancer, which represents about 1 to 5% of all cases, frequently presents with symptoms like tenderness, redness, and swelling. If you notice pain that doesn't follow your typical cycle, especially if it's paired with other changes like a lump or skin alterations, it's time to consult your doctor. Early detection saves lives, and understanding subtle symptoms like persistent tenderness can make a difference. Don't ignore what your body's telling you. Next, number 9, pain in the chest area. Chest pain can sometimes signal breast cancer, though it's less common. This type of pain might feel deep, localized, and persistent rather than widespread or fleeting. If a tumor is growing near the chest wall or compressing surrounding nerves, it can trigger discomfort in this area. It's crucial not to dismiss such pain, especially if it's consistent and unexplained by other conditions like muscle strain. Recent research published in Frontiers in Pain Research, 2023, highlights that around 5 to 10% of individuals with early-stage breast cancer report pain as a primary symptom. The study emphasized that this pain is often misattributed to benign causes, delaying diagnosis. For instance, inflammatory breast cancer, a rare but aggressive form, can present with localized pain even in the absence of a lump. Early detection of breast cancer significantly improves outcomes. If pain occurs alongside other signs, such as skin changes or nipple discharge, a medical consultation is essential. While most chest pain is benign, addressing unexplained or persistent discomfort early can make a difference. Routine self-exams and paying attention to subtle changes in your body are key to staying ahead of potential issues. Next, number 10, unexplained weight loss or fatigue. Feeling tired all the time or losing weight without trying might seem unrelated to breast cancer, but they can sometimes be subtle clues. These symptoms often appear when the body is under stress or fighting something serious, like cancer. When breast cancer develops, it can disrupt normal bodily processes, leading to fatigue and unexplained weight loss. This happens because cancer cells use up a lot of the body's energy and nutrients, leaving less for essential functions. Fatigue, in particular, can result from inflammatory molecules released by the body as it tries to fight the cancer. A 2020 study published in Journal of Patient-Reported Outcomes found that early-stage breast cancer patients reported significant fatigue even before starting treatment. This fatigue is often not relieved by rest and can affect daily life. Weight loss may occur as cancer alters the way the body processes food and energy. Research in NPJ Breast Cancer, 2023, explains that cancer-related weight loss often stems from metabolic changes and a loss of muscle mass rather than just fat. Paying attention to these signs and seeking medical advice early can make a huge difference. If these symptoms persist or worsen, it's crucial to have them checked out. And that wraps up our journey through the early signs of breast cancer. Remember, awareness is power. Knowing what to look for can make all the difference for you or someone you love. If you noticed anything we discussed today, don't wait. Reach out to a healthcare professional. Early detection truly saves lives. If you found this video helpful, give it a thumbs up and share it with someone who might need it. You never know whose life you could impact today. Don't forget to subscribe for more health insights and tips. Take care of yourself, and I'll see you in the next video.